Assalamualaikum and good morning, everyone. So we are pharmacy students from University of Brunei Darussalam. So today we will be sharing our experience of conducting a community project to raise awareness of prostate cancer in men during the COVID-19 pandemic. So these are the contents we will be talking about for today. And as an introduction, I'll be talking about the objectives of our project at the time. So first, we aim to spread awareness of prostate cancer in men to the general public. We also aim to share the information by means of social media. We also wanted to educate the general public through an in-depth manner through an online webinar. And to evaluate the impact to the community, we formulated a pre and post questionnaire to assess the public's knowledge about prostate cancer. So the online webinar was held on the 24th of September of 2021 via Zoom meeting where 40 participants joined the event. And during the beginning and end of the event, we did a pre and post questionnaire to assess the knowledge of the participants regarding prostate cancer. The main event was then the presentation where we talked about the necessary information such as symptoms and diagnosis of prostate cancer. We then moved on with a Q&A session where it was some of the participants' questions during the events are actually shown here. And lastly, we also did a Kahoot quiz session about prostate cancer where the top 3 winners won some prizes. So the next bit will be explained by Ayuni.
Moving on, the second intervention project conducted was a virtual run and a merchandise shirt. So a virtual run is a race in which participants can run, jog, or walk at any location they want, such as on a road, a track, or on the treadmill at the gym, or at home as long as they complete the distance they registered for within the running period. So the purpose of the awareness run and t-shirt are to increase exposure to prostate cancer awareness as well as improve the advocacy as they send the message without the need of any verbal communication. Additionally, the event can also educate on the condition because in some instances, people are more likely to search up on the cause prior to joining the event or buying the merchandise t-shirt. Moreover, the awareness run and shirt can express unity and solidarity towards the prostate cancer community. Next is a photo showing the poster we advertised through Instagram and the university's email. We chose to do a virtual run because it was safer and more convenient for participants at that time. In our virtual run, there were 3 running categories, which were 10, 21, and 42 kilometers. Participants registered for the run via Google Forms for 20 Brunei dollars, inclusive of a shirt, drawstring bag, purple ribbon, which signifies cancer awareness in general, and upon completion, they will receive a medal and e-certificate. Unfortunately, due to the COVID-19 situation, some changes had to be made to the event. For example, the running period was delayed to give room for the COVID situation to get better. Number of the participants were greatly reduced to 80 runners only, and there had also been a delay in giving out the participants running kits and medal afterwards. Fortunately, however, everyone was very, very understanding. As mentioned before, we also launched a merchandise shirt for those who do not want to join the run, but still want to own the shirt at a lower price of 15 Brunei dollars. For both running and merchandise shirts, they had a main color theme of blue and the tagline of "We all fight together," symbolizing that we support the prostate cancer community to fight against the condition and hope for recovery to those who are suffering from the condition.
Hello, everyone. My name is Uncle Khairi, and I'll be talking about the publicity strategy of our community project. So we have promoted our awareness project through different platforms, which are Instagram, WhatsApp, emails, and even by means of communication with other people. Firstly, we have created an Instagram to further promote the community project's interventions, which was previously mentioned by previous speakers, the virtual run and the online webinar. Apart from that, with the help of the faculty's admin registrar, advertisements were sent through emails to other UBD students about the online webinar to further gather people for the talk. Here we have posted a teaser on our Instagram about the webinar, and also we have posted a post where we gave a chance for the participant to win some prizes. In addition, our Instagram also posted several posts regarding the poster of the virtual run, registration process, and the countdown of the run. Moreover, we utilized our Instagram to do some polls and quizzes to get the public's knowledge regarding prostate cancer, mostly on the cases, prevalence, signs and symptoms, screening, and about its complication. And this poll can be reviewed on our story highlights for our future reference at that time. Last but not least, we also posted several fun facts about prostate cancer, explaining its definition, signs and symptoms, and ways to reduce the risk of getting prostate cancer, and a lot more.
Hello, my name is Ayuni, and I will be covering the challenges and limitations that we faced throughout our project. There were several challenges that enabled us to fully utilize our ability and capability to spread awareness on prostate cancer. It is beyond the scope of this study to fully address its objectives for numerous reasons. Firstly, due to the COVID-19 pandemic, the team had to change plans from physical face-to-face talk to an online webinar instead. As a result, our progress was slowed down and we also had to redo some of our paperwork. Subsequently, this hugely affects the ability of having a targeted audience for the talk, as the team initially planned to deliver the talk to the elderly community that are at a higher risk of getting prostate cancer. There was also a limitation on the accessibility of joining the online webinar. It required participants to download the Zoom application, which could be an issue to certain people, especially the elderly, who might have difficulty in doing so. On top of being an online session, having poor internet connection may also hinder the maximum delivery of the talk, as it lowered the level of immersiveness of the audience due to the lack of face-to-face interaction, thus affecting the level of understanding of the topic being conveyed. Furthermore, in accordance with our webinar content, there were several issues that were not covered in the light of prostate cancer in men, which include lack of exposure to the topic and reluctance on screening. Not only that, we had insufficient information such as the statistics and data on prostate cancer in Brunei. We also found it difficult trying to relate some of the points that were brought up during the webinar, including the treatments and screening availability in Brunei. In spite of the obstacles faced, we viewed such experience as a blessing in disguise, with many skills learned and adapted to online-based activities that are needed in this digital era. To conclude, we conducted 2 intervention projects for our title Prostate Cancer Awareness in Men, namely the awareness webinar and virtual run. We made great use of social media to make these successful interventions. Although we experienced a few challenges, mainly due to the COVID-19 pandemic, there were overall positive results from both interventions, where majority of the webinar participants gained new knowledge on prostate cancer after the presentation, and running participants were expected to be informed and aware of the project's advocacy. Thank you for listening.